right, good afternoon. My name is James Ghattas. I'm the third year medical student at Lincoln Bradenton. Today I want to talk about the use of OMT to treat edema in a patient who underwent hyperthermic intraperitoneal chemotherapy. First, I'd like to give a big thank you to Dr. Eric Hedgebelly, who's in the crowd, and the Cancer Treatment Centers of America. So HIPEC is a surgery that treats widespread metastatic ovarian cancer by bathing the abdominal diaphragm in the abdominal cavity in heated chemotherapy drugs via an inflow valve right there and an outflow valve. So our case is of a 51-year-old Caucasian female with a history of metastatic ovarian cancer who was post-op day 14, status post HIPEC procedure. We were consulted for psychiatry to evaluate a suspected delirium, and she had a prolonged recovery complicated by malnutrition and difficulty breathing. She had several abdominal surgeries in the past, as well as long-standing chronic edema. There was a history of tobacco abuse and alcohol abuse. Her BMI was 20.9, so you can imagine that our patient was a very petite individual. And lab values showed, her ABG showed hyperventilation and hypoxemia. So, on physical exam, there was significant pitting edema in the back, pelvis, and bilateral lower extremities. There's 4+ pitting edema in both right and left legs. She also had massive pleural effusions, tremulous voice, tremor in her hands, nystagmus, and ataxia. And this is a demonstrated picture. Osteopathic structural exam was consistent with someone who would have lymphatic restrictions. Her CRI was a full amplitude, which really signifies that her body was in overdrive trying to heal. She had suboccipital hypertonicity bilaterally. She had tightness in substance fascia, restricted movement in the lower ribs, asymmetry of the bony landmarks of the pelvis, and restriction in innominate rotation, as well as tightness in the popliteal and plantar fascia bilaterally. Our assessment was delirium of unknown medical etiology. However, the delirium was resolved with atypical antipsychotics, as well as she had edema. So what do we do about this? Well, like any surgery, there's going to be post-op complications, but in this case specifically, there were pleural effusions and generalized edema. So what can the effusions tell us about the edema? Well, this surgery is very traumatic to the diaphragm. It strips the diaphragmatic peritoneum, causing occult communications between the abdominal cavity and the thoracic cavity. It also damages the phrenic nerve, all in all hindering proper diaphragmatic contractility. She was also on TPN, which we believe contributed to a refeeding syndrome in which she had massive fluid and electrolyte shifts out of the plasma and into the cells and into the interstitium. This can also cause a thiamine deficient delirium. So we know that the lymphatics are ubiquitous. They're responsible for flushing fluids and proteins out of the tissue and into the circulation, and it gives us a nice big safety factor. So it relies on 3 mechanisms. 1, unimpeded flow through the thoracic duct, proper function of the transverse diaphragms throughout the body, and then contraction of the musculoskeletal system to bring fluid from the periphery back centrally. So we know that the lymph vessels are weak and flabby. It's a zero pressure system. It doesn't have a pump. There's no myocytes. They can get kinked very easily. And when they get kinked, you have fluid backup and edema. And in this case, the furosemide just wasn't able to reach the fluid in order to diurese. So what do? We need to get our safety factor back. On post-op day 21, after the delirium was resolved, Dr. Hedgebelly and I got the okay from the hospitalist to carry out our OMT plan. The physical exam was unchanged at that point. So our treatment plan was aimed at 3 things: removing myofascial restriction to improve lymphatic flow, also to improve the transverse diaphragms in order to reestablish positive pressure gradients, and to mobilize fluid by inducing an oscillatory pedal pump. Our treatment was a very standard lymphatic treatment. We addressed first and foremost the substance fascia on the left, and then we addressed all the transverse diaphragms from bottom to top, starting with the plantar, popliteal, pelvic, abdominal, and even the tentorium cerebelli. This is a simple demonstration of releasing substance fascia, plantar fascia, popliteal fascia, addressing the pelvic diaphragm, and isotonic muscle contractions to the abdominal diaphragm. This was then followed up by a pedal pump that lasted about 1.5 minutes. And my favorite part is that we were able to instruct the patient's husband on how to do these key lymphatic techniques. Follow-up 5 days later revealed significant reduction of the edema in her body and her lower extremities. She went from 4+ to 0 in the right leg, and 4+ to 1+ in the left leg, the other way around. The circumference of her left ankle went from 29 centimeters to 22 centimeters in circumference, and her bony landmarks were very palpable. She hadn't seen results like this in about 3 years. And we gave her a second treatment 7 days later, and a 10-day follow-up after that revealed that there was no return of the edema. So what did we learn today? This is a great example of how OMT is a very simple technique that can give us great results. The entire treatment time took 20 minutes, and we were able to instruct the patient, or the patient's husband at this time. It's a very versatile treatment. We were seeing her for a psychiatric evaluation, and we were able to treat her edema. This also gives us a very good opportunity to discuss the relative contraindication of OMT in cancer. And I stress relative because you really have to approach the patient osteopathically. We really weren't treating the cancer in this case, we were trying to improve her quality of life. After we reduced the edema, she was able to get up, ambulate, interact with her family members, and really you can imagine the tremendous psychiatric benefit that imparted on her and her loved ones. So it's really OMT in its truest form. These are my references. Thank you very much.